In this morning's Health Watch, Serena Williams' health scare. The tennis star suffered a pulmonary embolism last week, a blood clot in her lung, and then needed emergency treatment on Monday due to complications. Medical correspondent Dr. Jennifer Ashton is here with more on this condition, which affects at least 100,000 Americans each and every year. Doctor, good morning.
Good morning, Chris.
Before we start, I just want to quickly read a statement that we got from Serena Williams yesterday, released to CBS. This has been extremely hard, scary, and disappointing. So that's her statement. But let's talk exactly what she has been dealing with here.
We're talking about a pulmonary embolism, Chris, as you said. So this is normally a blood clot that starts usually in the leg or lower extremity and then travels up the body into the heart and lodges in the lungs. Can give you symptoms of an increased respiratory rate, an increased heart rate, some shortness of breath.
Could this have killed her?
It could. You know, when this clot is small, it can cause a little bit of lung damage. When it's large, absolutely, it can be fatal.
I think a lot of people sitting at home saying that she's a world-class athlete. This is one of the best tennis players in all the world. How does something like this happen to her?
Well, we do know that Serena Williams has had 2 operations on her foot recently, and surgery can be a risk factor. Usually the high-risk surgeries are surgeries of the hip or knee, but also pelvic surgery. Really, any type of surgery can increase your risk, and this is an example about even young elite athletes can have this happen.
And do they think that's kind of directly related to these foot surgery? I mean, these were minor surgeries. She stepped on glass in a bar. I mean, I know it's still surgery.
You know, it's hard to tell. When you talk about the risk factors for a pulmonary embolism, Chris, the list is long. That we know that as you get older, the risk increases with age. Things like smoking, obesity increase the risk. Then there are some big ones. Cancer increases the risk of a clot. Women who take birth control pills or hormones, all hormones increase the clotting risk, and prolonged immobilization. So anyone who's on a long plane or car trip or surgery.
So the risk doubles every 10 years after age 62.
Right.
So even as you get older, you have to be much more aware of any type of symptoms. How do you prevent something like this from happening?
Well, first of all, modify the factors that you can control. If you know you're going into surgery, a lot of surgeons will give a medication to prevent blood clots even before we take a patient into the operating room. And then if you know you're going on long travel, you want to get up every hour that you're not sleeping, move your legs, stretch your legs, do a little bit of exercise, keep yourself well hydrated. And then there are certain compression stockings that you can get, either knee-high or full-length stockings, that I actually suggest all my patients who take a long flight wear. They can be helpful. If you have a family history of a clotting disorder, obviously you get tested for that and you know that.
When do you think, I guess with something like this, could people expect to see Serena Williams get back on the court playing tennis again at the level where she was?
Well, she's said she hopes to be back in the summer. She will be on medication to treat this for months, and she will be able to participate in athletics while she's on that medication, so we'll have to wait and see.
Is that Coumadin? Is that
yeah, blood thinner.
Great.
Exactly.
All right, Dr. Ashton, thank you very much.
Bet,
Good to
Chris.
see you.